Today we're going to tackle chapter 4, which deals with opiates and opioids and sedative hypnotics. We're going to talk about depressants. There we go. Depressants depress the activity of the central nervous system, period. They sedate, they cause muscles to relax, they may depress inhibitions, they may change your emotions, they may change your impulses. Well, they probably will. They mimic the natural inhibitory neurotransmitters endorphins and enkephalins and gamma-aminobutyric acid, also known as GABA. Three major classes of downers are opiates, opioids, sedative hypnotics, and alcohol. We're not going to talk about alcohol in this chapter. Alcohol is chapter 5. Four minor classes of depressants: skeletal muscle relaxants, antihistamines, over-the-counter depressants, and look-alike depressants. Something we don't see in the United States. Look-alike depressants are mostly in Europe. Opiates, opioids, opium, of course, morphine, codeine, hydrocodone. Another name is Vicodin. Oxycodone, also known as OxyContin, methadone, and heroin. You can add to that fentanyl, of course. And there's a new one that I can't think of that is 1,000 times stronger than morphine. Originally, it was developed as painkillers, cough suppressants, and diarrhea treatment. Really slows down the bowels. Problem is that when people take too many opiates, opioids, they can become constipated to the point of blockage. Sedative hypnotics are synthetic chemicals developed to treat anxiety and insomnia. Started out with naproxate, which is also known as Miltown, the barbitals, the phenobarbital, pentobarbital, secobarbital, seconal, Dilaudid, methaqualone, the quaaludes, and rohypnol, which is the date rape drug, GHB, which is also a date rape drug, and then the benzodiazepines, Xanax, and Valium. Alcohol is a natural byproduct of fermentation process of plant sugars or starches. This is the oldest psychoactive substance used by humans. Alcohol is the world's second most destructive drug after tobacco. Skeletal muscle relaxants, synthetically developed central nervous system depressants that target the area of the brain that is responsible for muscle coordination and activity. Good examples are Carisoprodol, which is another name for it is Soma, chlorzoxazone, which is Paraffin Forte, clobenzarine, also known as Flexeril, baclofen, lioresal, which I've never heard of, and methylcarbamol, which is Robaxin. These are fairly common in the United States: Soma, Paraffin Forte, Flexeril, and Robaxin. Antihistamines are found in cold and allergy medications to block the neurotransmitter histamine. Synthetic drugs are used to treat allergic reactions, to prevent ulcers, to prevent shock, to prevent rashes, to prevent motion sickness, and to prevent symptoms of Parkinson's disease. They use antihistamines. Over-the-counter depressants are sleep aids or sedatives such as Nitol, Sleep-Ease, and Sominex. The active ingredients in over-the-counter depressants are scopolamine, antihistamines, bromide derivatives, and alcohol. Lookalike depressants are rarely seen today, especially in the United States. It's mostly a European problem. Opiates are products of the opium poppy. That's what an opium poppy looks like. Opioids are synthetic versions of the opiates. Opiates come from the milky sap that oozes from the unripe seed pod of the flower. It will ooze for about a week. It can be milked about 6 times at any given season. And that's what it looks like. They just make cuts in it, and it oozes this milky stuff. Opium produces over 25 alkaloids. The two most important are codeine and morphine. Codeine makes up about 0.7% to 2.5% of the opium exudate. Morphine makes up 10 to 20% of the opium exudate. A third alkaloid that is a stimulant rather than a depressant is thebaine, and I've never heard them doing anything with thebaine. That's the ooze, as you can see, not very much there, so only a relatively small percentage they can use. Semi-synthetic opiates are opiates that are refined in a select way to produce a psychoactive substance that is partially natural and partially synthetic. Heroin is that way. Vicodin, Percodan, and OxyContin and Dilaudid are all semi-synthetic opiates. Fully synthetic opiate drugs include methadone, Demerol, and Darvon. Another name for Demerol is meperidine. And another name for Darvon is Propoxyphene. Synthetic opioid antagonists, naltrexone and naloxone. Opium poppies were first cultivated in ancient Mesopotamia. It then spread north to Greece and west to Egypt, eventually making its way east into Asia. Opium was used in many medicines in the Old World, but its ills were seen even then when various writers wrote of its addictive properties. Opium tended to be used as an additive, eaten, chewed, or mixed with liquids, and drunk. In the early 1500s, opium regained popularity when the Swiss chemist Paracelsus began making a tincture mixed with alcohol with opium powder. This he called laudanum. It was used to treat dysentery, pain, diarrhea, and coughs, and it worked very well. It stops diarrhea, of course, which is what dysentery is. It blocks pain and it stops you from coughing. Opium continued to be used in medicinal mixtures for the next 3 centuries. Paregoric, the tincture of opium with camphor, was developed for the treatment of diarrhea. My mother was suffering from gallbladder disease, and she called up the pharmacist, and she got paregoric to stop her diarrhea from her gallbladder. This mixture is still used today. Opium smoking became popular in the 16th century. This means of drug introduction puts more of the active ingredients into the system faster, about 7 to 10 seconds. Because the psychoactive ingredients enter the bloodstream and brain faster, there is a greater sense of euphoria, well-being, and relaxation. Modern methods of smoking heroin involves heating the substance in tinfoil and inhaling the fumes through a straw. This is known as chasing the dragon, and that's what it looks like. She's chasing the dragon. In 1805, the morphine alkaloid was first isolated from opium and was found to be 10 times stronger than opium and thus a more effective painkiller. Morphine was first used in the Crimean War from 1853 to 1856. That was a war between Russia and England. And then during the American Civil War. Opium poppies were actually grown in the South to provide morphine for the Confederate troops. In 1832, the weaker alkaloid codeine was isolated from opium. It was found to only be twice as strong as a painkiller as opium. Codeine was used to treat coughs and general neuralgia. Neuralgia, of course, has to do with vague muscle pain and nerve pain. In 1874, a British chemist boiled the morphine with acetic anhydride to create an opiate synthetic that was 5 to 8 times stronger than morphine. Bayer Pharmaceuticals of Germany bought the chemical and named it heroin. Its effects were heroic on the individual. Bayer marketed it as a cough suppressant, chest painkiller, and a treatment for tuberculosis and pneumonia. Heroin crossed the blood-brain barrier more rapidly than morphine. The result was a more intense and rapid rush in euphoria. It is estimated that at the turn of the 20th century, there were between 250,000 to 1 million morphine and heroin addicts in the United States. Through the 1800s, patent medicines were produced that contained opiates. These patent medicines were used for such problems as tired blood, colicky babies, coughs, diarrhea, and toothaches. They were used to quiet loud children and to aid in sleeping. Surprisingly, surveys showed that more than half of the opium addicts were women. somewhere between 56 and 71%. It was mostly for tired blood. Famous opiate addicts of the 19th century: Jane Addams, the lady that started social work. Famous opiate addicts of the 19th century: Sarah Bernhardt, Elizabeth Barrett Browning, a poet. Oh, I'm sorry, Sarah Bernhardt was an actress. Elizabeth Barrett Browning was a poet. Charlotte Bronte, of course, was an author. Louisa May Alcott was an author as well. Samuel Coleridge was an English poet. Charles Baudelaire was a French writer, actually. Lord Byron was an English poet. John Keats, another English poet. Edgar Allan Poe, a short story writer from the United States. Algernon Swinburne was also a poet, English poet. Opium, morphine, and heroin became the health concern in the United States around the turn of the 20th century. In 1906, the Pure Food and Drug Act was passed, limiting the manufacture and use of opiates. In 1914, opiates became the first drug considered a narcotic in the Harrison Narcotics Act. By 1924, heroin production was outlawed in the United States. In 1915, only 63 of the people incarcerated in federal prisons were incarcerated for narcotics violations. By 1928, 1 out of every 3 people were incarcerated because of narcotics violations, which was 2,529 prisoners. By 2004, 86.5% of the federally incarcerated prisoners had been convicted on drug offenses. 155,900 prisoners out of 180,328. Because of the market for opiates in the United States, criminal organizations sprung up to supply the demand. Chinese triads, the mafia, the French Connection, Mexican narcotraficantes, African traffickers, Russian mafia, Colombian cartel. So if you received opiates, if you were on the West Coast, it was probably from the Chinese triads. If you're anywhere, well, you're in Arizona, New Mexico, it's probably the Mexican narcotraficantes. If you live on the East Coast, it was probably from the mafia, the French Connection, or the Russian mafia if it was in Florida. Up along the southeast, it was probably from the Colombian cartel. At present, 4.6 million Americans use opioids illicitly every month. Only 136 to 800,000 of these individuals are heroin users. 3.5 million people in the United States have tried heroin. The rest are prescription drug abusers, OxyContin and Vicodin. A new wrinkle that is appearing in Dallas area junior and high schools is cheese. It's a mixture of a little Mexican brown heroin and over-the-counter medications containing antihistamines. The mixture gives the individual a rush. Several deaths have caused a nationwide scare, and it looks like Parmesan cheese. Worldwide, 5 to 10 million people are regular heroin users. The United States only consumes about 3% of the heroin produced. The areas that are affected the most are Europe and Asia. 92% of the world's heroin is produced illegally in Afghanistan. Most of the world's legal opium for pharmaceuticals is grown in India. Most of the heroin coming into the United States comes from Mexico. Medically, opioids are prescribed to deaden pain, to control coughing, and to stop diarrhea. Non-medically, opioids are used to drown out emotional pain, to get a rush, to induce euphoria, and to prevent withdrawal symptoms. Pain is transmitted to the central nervous system through the neurotransmitter substance P. The P, of course, stands for peptide. The more substance P that is released in the synaptic cleft, the greater the pain. The body modulates the intensity of pain by blocking substance P receptor sites with endogenous painkillers, endorphins, enkephalins, and dynorphins. The endogenous painkillers occupy the substance P receptors, the opioid receptors, referred to as mu receptors, kappa receptors, delta receptors, and non-opioid sigma receptors. Exogenous opioids work because they occupy the opioid receptors, acting as if they were endogenous painkillers. Endogenous painkillers are also activated when an individual feels anxious. It decreases anxiety, produces a sense of detachment. It makes the individual feel drowsy. It deadens the unwanted emotions. These effects occur because of the inhibiting effect of the endogenous or exogenous painkillers' effects on the locus ceruleus. Opioids induce pleasurable feelings by slotting into receptor sites meant for the endogenous painkillers, inhibiting the action of GABA, triggering glutamate receptors, enhancing dopamine neurons in the reward reinforcement pathway, and increasing the release and enhancing the effect of dopamine. Heroin has the strongest effect of all the opioids. The reward reinforcement pathway performs two functions. It signals pleasure so that an act is more likely to be repeated. It signals the alleviation of pain. Research has disclosed that relief of pain is a stronger incentive than the introduction of pleasure. With psychoactive drugs, especially opioids, the desire to prevent withdrawal symptoms is a stronger incentive for continued use than the desire for pleasure. When an individual is prescribed opioids, a non-abuser will use the medication until the pain relief threshold is found. An abuser will use beyond the pain relief threshold, searching for an emotional high. Chronic users of opioids will use the drug in excess to prevent the withdrawal symptoms they are seeking to return to the normal state. Opioids, like receptor sites, have different functions. Mu and sigma receptors trigger the reward reinforcement pathway. They block pain transmission, they change mood, cause pupil contraction, depress the autonomic nervous system, respiration, and blood pressure. So that it slows down your respiration and it lowers your blood pressure. Kappa receptors induce dysphoria, induce endocrine changes, control pain at the spinal cord level. Excuse me. Opioids suppress coughs by blocking the activation of the cough center in the brainstem. Codeine and hydrocodone-based cough suppressants are still widely used. That would be Robitussin AC and Hydrocodone syrup. People will abuse these substances for the psychedelic effects. Unfortunately, an overdose of psychedelic substance, dextromethorphan, can cause respiratory suppression, nausea, and vomiting. Overdose of cough suppressants is usually in combination with other depressants such as alcohol, benzodiazepine, and antidepressants. Opioids are also given to control diarrhea. Opioids work on the brainstem to inhibit gastric secretions and depress the activity of the gastric muscles. Opioid addicts may suffer from severe constipation, and of course this is the problem. They can get a blockage. If you've ever heard of anybody having a bowel blockage, if they're an older individual or if they are in the entertainment industry, there's a great probability that they've been using opiates or opioids. That's not fair. Liam Neeson had a bowel blockage, and his was caused by painkillers. Opioids affect every part of the body, but especially your heart, your lungs, your brain, your eyes, voice box, muscles, cough center, nausea center, reproductive system, excretory system, and immune system. Oddly, my barber has just had a bowel blockage, and it was because he had cancer, and they treated him for the cancer. It was colon cancer. Actually, it was anal cancer, and he had to have his a colostomy put in, but they gave him the painkillers because of his cancer and his cancer treatment. And they didn't tell him about the constipation. and so he got a strangulated bowel, and because of that, he had to have his bowel resected again, and he's retired now. He's not my barber anymore. Physical side effects of opioids, but especially heroin, include insensitivity to pain, lowered blood pressure, lowered pulse, lowered respiration rate, and confusion. At stronger doses, opioids, but especially heroin, might cause droopy eyelids, nodding head, slowed, raspy speech, slowed coordination and walking gait, pinpoint pupils, and this is how we identify people who have overdosed on heroin if they come in the emergency room. The first thing we do is we look for their pinpoint pupils. If they have symptoms that are similar to a heroin overdose, we open their eyes and see if the light causes their pupils to contract. Because when your eyes are closed, your pupils are pretty much wide open. But if you look at a heroin user, as soon as you open his eyelids, you can see that his pupils didn't have to contract because they're pinpoint. Histamine release causing itchy, dried skin, suppression of the cough center hindering the clearance of phlegm, vomiting due to the activity of the nausea center, severe constipation, delayed menstruation, reduced testosterone production in males, dulled sexual desire to the point of indifference. This is one of the reasons why you'll never find we have a crack whore individuals who were taking amphetamines, methamphetamines. They actually have a stronger sex drive, at least in the beginning they do. But if somebody is a heroin user and they're prostituting themselves for heroin, the probability that they would use and then service individuals is fairly remote because it just doesn't work that way. Their sexual desire tanks. If they're a male, their sexual desire goes away almost completely. Tolerance for opioids. So when we talk about a crack whore, that's logical. But when we talk about a heroin whore, that's not possible at all. They could still do it, of course, but they just don't have any desire to have sex. Tolerance for the opioids occurs when the body tries to neutralize the toxin. It does this by speeding up metabolism, especially in the liver, desensitizing the nerve cells of the substance effects, increasing drug excretion by increasing urine, feces, and sweat output, alteration of the brain chemistry to compensate for the effects of the drug. Opioids tolerance is very rapid, and the individual might multiply their dosage 10 times in 10 days to get the same effect. Chronic use of opioids can cause permanent changes in the brain. Animal studies show that the heavy usage of opioids will reduce the dopamine-producing cells in the ventral tegmental area by 1/4. Hence, these individuals have less of an ability to feel pleasure or even feel normal, another reason to take the drug. At this point, the body relies on the drug to feel normal. Withdrawal from opioids may take place in 3 stages. Acute withdrawal, the body tries to return to normal too quickly. Post-acute withdrawal, subtle emotional and physical symptoms such as mood swings and sleep problems that may persist for 3 to 18 months after use of the drug. Protracted withdrawal, more severe emotional and severe symptoms that may start after the first month and last into the 30th week. Decrease in blood pressure, decreased body temperature, decreased respiration, feeling of general uneasiness. This reaction might be triggered by environmental cues that incite memories of their addictive life. These cues can persist for decades after cessation of use. And this is one of the reasons why when entertainers are heroin addicts, it really changes them. It changes them a great deal. Short-acting opioids, 2 to 3 hours, result in more acute withdrawal symptoms that may begin 8 to 12 hours after chronic use. 3 short-acting opiates would be heroin, morphine, and hydromorphone or Dilaudid. Withdrawal peaks at 48 hours and lasts for 5 to 7 days. Long-acting opioids will delay the withdrawal symptoms for 1.5 to 3 days. Methadone and LAAM which is rare in the United States. It's used like methadone in LAAM clinics in Europe. Peak withdrawal hits at fourth to the sixth day, and recovery may take as long as 2 weeks. Opiates, opioids that resemble codeine have a withdrawal pattern that is somewhere between the short and long-term opiates, opioids. Codeine, OxyContin, and Darvon. Propoxyphene. One of the curious withdrawal symptoms of opiates, opioids is hyperactivity. This is caused by a sudden release of an excess amount of norepinephrine. Norepinephrine release is inhibited by the opiates, opioids. All in all, people rarely die from opiates, opioids withdrawals, as they may do with alcohol or sedative-hypnotic withdrawals. The results are similar to a severe case of the flu. The problem with opiates, opioids withdrawal is the fear of the withdrawal, since this is the area of the brain that is most affected by the drugs. Neonatal effects of opiates, opioids usage are extreme because the drugs readily cross the placental barrier. Pregnant opiates, opioid users are at greater risk for miscarriage, placental separation, premature labor, breech birth, stillbirth, and eclampsia. There's a reason why the breech birth is common. Normally, a baby will do a somersault just before it's born so that its head is up against the birth canal. But with a mother that's been taking opiates, opioids excessively, the baby, these reflex actions that the baby has to take to get out of the birth canal isn't happening. So that's one of the reasons why there's so much stillbirth, why there's so much breech birth. Eclampsia, because the woman has to go off of her hair, or is supposed to go off of her heroin. She certainly isn't on heroin while she's having the baby. And eclampsia is a huge increase in blood pressure. And of course, normally she's been reducing her blood pressure with opiates, opioids. In the fetus, if the fetus survives these dangers, it will be just as addicted at birth as the mother is, though due to the size and dilution factors, the withdrawal symptoms are more severe. They tend to be low birth weight, high-pitched cry, irritability, tremors, exaggerated reflexes, diarrhea, rapid breathing, sweating, vomiting, sneezing, yawning, and hiccuping. If the neonate survives the withdrawal, the effects will last from 5 to 8 weeks. I don't know if I've told you guys, but other students know that I had a great nephew that was born addicted to heroin by an idiot mother. What happened was she claimed to be bipolar, and because she was bipolar, every time she got arrested for something, they had to let her go because of her mental illness. So she got arrested she was using speed, and she got arrested. Her boyfriend was her supplier. So she got arrested for erratic behavior. They discovered she was pregnant, and they discovered that she was a user. That she was not only using she was using amphetamines to counteract the heroin, because the heroin would just make her sleep all the time. So they decided that since she was pregnant, they didn't want to put her in jail. So they put her on a state-controlled program where they gave her a methadone-like substance. It wasn't methadone; it was something else. And that was supposed to keep her from using heroin. But of course, that's not what she did. She not only used the methadone, but she also shot up with heroin at the same time. So she was a mess. She was a real mess. And she still is a real mess, by the way. The baby was born addicted to heroin. And it was terrible. I mean, if you've ever been around a baby that is an addict, this is the worst part, the high-pitched cry. And it's constant. It's like a cat just got caught in the car fan or something, and it's constant. They're irritable. They have seizures. It's a real mess. Anyway, the baby survived. I haven't seen him in a couple of years, but it took him between 6 and 8 weeks to get off of the heroin, and now when I saw him, he seemed a little bit ADHD, but he was okay. It's my brother that is taking care of him. His great grandfather and great grandmother are taking care of the baby, and I told him, I warned him, and they'd never listen to me because I'm an idiot. But I warned them that this child needed to stay away from everything, that you couldn't give him anything. He would become addicted to obsessive compulsive and addictive to just about everything because this is how his brain developed. As an addict, it developed as an addict. So hopefully, when he becomes obsessive compulsive, he will only be obsessive compulsive about positive things and not negative things, like exercise or whatever. Hopefully, nothing negative. In the early 21st century, 4,000 to 5,000 people died from opioid overdoses every year. Last year, 130 people died from opioid overdoses every day. That's 47,450 people. 14 million drug-related emergency room visits occurred in 2017 related to opioid overdoses. In one study, only 57% of the opioid overdoses were accidental. What opioid overdoses look like: blood pressure drops, the heart isn't beating rapidly enough to circulate the blood. Because the heart isn't beating, the lungs fill up with fluid resembling drowning. The lips turn blue as the hue begins to imbue the entire body. The pupils become pinpoint. Respiration begins to rasp and rattle. They go into convulsions as much from the lack of oxygen as from the toxins in their system. It is not a pretty sight. It's very, very painful to watch somebody do this because the only thing you can do is give them naloxone or naltrexone to break the cycle of the opioids. It's the only thing you can do. If you try to give a mouth-to-mouth resuscitation, doesn't work. Nothing works. You can do heart palpitations. You can do lots of things to them, and nothing seems to work except for naltrexone. Death by overdose is one way to die from opioids. Another is to contract a disease from sharing needles. According to research, 50 to 90% of IV heroin users carry the hepatitis C virus, which we can now treat, by the way. Once upon a time, we couldn't, and once upon a time was only a couple of years ago. A look at individuals who have only shot up for a year shows a rate of 71.4%. 20 to 40% of those infected will develop liver disease. 4 to 16% will develop liver cancer. 50% of all IV drug users are HIV positive. 25% of all U.S. HIV/AIDS cases were transmitted from the contaminated IV drug users. 3/4 of these individuals are male. 7 to 10% of HIV/AIDS cases in the United States are transmitted through sexual contact with heterosexual or homosexual IV drug users. 70% of children with HIV have mothers who were IV drug users or the sexual partners of individuals who were IV drug users. IV drug abusers will do just about anything to get their fix, and this is one of the reasons why there are so many people with hepatitis C and AIDS, because they will prostitute themselves to get their drug. Heroin fairly quickly scleroses the veins being used for injecting, so that the individual has to go to more and more difficult sites for their fix. The wrist is fairly easy between the toes. In the neck, which is not easy to hit, you have to look in the mirror and everything's backwards. Even the dorsal vein in the penis, individuals will shoot up just about anywhere. Now, sclerosis means that it's hardening. That's what sclerosis means. So the veins become so hard you can't get a needle into them. And having drawn thousands and thousands of people, having drawn their blood, I can tell you that a sclerosed vein is almost impossible to get blood out of. Heroin users may inject themselves 6 times a day, and sanitation is rarely the top priority. Septic abscesses and soft tissue ulcerations are often the result of unsanitary practices. Because the individual is immunocompromised by the drugs being used, the severity of the infections are sometimes catastrophic. Staph aureus and beta strep group A are just two of them. And there's a guy with septic, where is it? Septic abscesses. That's what it looks like. Not attractive. There are several conditions that are more common among IV drug users than non-users. Necrotizing fasciitis is what he has. Is a condition where a virulent bacteria gets under the skin and eats tissue away, and that's what's happened with this guy. Endocarditis, bacterial infection of the heart valves. Cotton fever, short-term bacterial infection, but that is necrotizing fasciitis. 58% of the people entering treatment for heroin addiction have been injecting the drug. Drug usage tends to start at different ages. The mean age for first alcohol usage is 16.4. The mean age of first tobacco usage is 17.3. The mean age of first marijuana usage is 17.4. The mean age of first heroin usage is 22.2. From first usage to daily habit averages about 1 year of sporadic usage. Research following a group of 582 heroin abusers for 33 years with an average starting age of 23.4 found that after 33 years, more than half were dead, 50 to 100 times greater than the general population. Most of them were dead from overdose, accidental poisonings, homicide, suicide, accident, liver disease. 44% still used heroin, 67% used tobacco, 22% were daily alcohol users, 35.5% used marijuana, 19.4% used cocaine, 10.3% used crack, 11.6% used amphetamines. The group reported high rates of mental health and health problems. The group that now averaged 57.4 years reported frequent interactions with the criminal justice system. Isn't that a shock? Morphine is metabolized by the liver. 3 to 6 times the morphine must be ingested to get the same effect as an individual gets from an injection. Morphine will be detectable in the urine for several days after ingestion. 1 out of every 6 Americans has a chronic pain problem due to arthritis, back injury, cancer, burns, severe tissue damage, or severe nerve damage. Some medical facilities spend over 1/3 of their appointment time dealing with chronic pain issues. In one research of chronic pain sufferers, 72% had suffered for more than 3 years, and 34% suffered more than 10 years. From this research, about half were afraid to use opioids, muscle relaxants, or sedative-hypnotics because fear of tissue dependence and addiction, fear that the painkiller would mask more serious diseases, fear that they might be thought of as a drug seeker trying to supply a habit. Risk factors in morphine addiction includes kidney and liver problems, drug abuse history, medical drug usage, mental health history, hereditary factors that make the patient more susceptible. Codeine is used for cough suppression. As a cough suppressant, it is a Schedule II drug, and when it is mixed with another drug for pain control, it is a Schedule III drug. Codeine was the most widely prescribed and abused opiate in the United States. Its #1 ranking, of course, has since been taken over by Vicodin, also known as Hydrocodone. Pimp C and DJ Screw Dead were dead. I'm sorry. DJ Screw is the guy's name. He's not Screw Dead. Pimp C and DJ Screw are dead from cough syrup overdoses, these two rappers. Hydrocodone is also known as Vicodin, Hydrocodone, Tussin, and Norco. This is a Schedule III drug. 120 million prescriptions were written for Vicodin in 2006. Abuse of this drug usually is precipitated after the drug has been prescribed legally. Heavy abuse has been known to cause hearing loss. 600 deaths a year are caused from hydrocodone overdose, usually when the narcotic is used with other depressants. And of course, that number has gone way, way, way up. This is an old figure. Methadone, Darvon, and Demerol were developed in German laboratories during World War II when the Axis powers were cut off from their supply of opium to provide painkillers of similar caliber to morphine. Methadone is less powerful than morphine and lasts longer in the individual's system. Methadone is authorized in the United States as a treatment for heroin addiction. There are 1,292 methadone treatment programs in the United States with 228,000 heroin addicts. Hydromorphone is refined from morphine, and gram for gram is 7 to 10 times more potent than morphine. Because it is of its potency, hydromorphone is stringently controlled. You probably know this as Dilaudid. Hydrocodone is a semi-synthetic derivative of codeine and is used for moderate severe pain. Its common names are Percodan and OxyContin. This drug is supposed to be taken orally. The effects begin after about 30 minutes. The effects last 4 to 6 hours. It is a stronger drug than codeine, but weaker than both morphine and Dilaudid. This drug can be abused by chewing or crushing and injecting or sniffing the resulting drug. The manufacturer of the drug tried controlling abuse by reducing the strength of the tablets. Demerol has been around longer than most of the synthetics and semi-synthetics. It is 1/6 the strength of morphine, but is widely used as an injectable anesthetic. In large doses, Demerol can cause sedation and euphoria, which makes it ideal for surgery because it doesn't suppress coughing or have the side effects of constipation. This drug is the most widely abused by medical professionals, meperidine or Demerol. Talwin is a weak opioid antagonist as well as agonist. When used in combination with other antihistamines, the drug is reputed to give a heroin-like high. Manufacturers have mixed the drug with naloxone, the opioid antagonist, to reduce its use as an opiate accelerant. This drug is rarely used now to get high because of the naloxone. Sorry, I was getting a drink. Propoxyphene is also called Darvon, Darvocet, Propocet, and Wygesic. It is used for mild to moderate pain relief. This drug metabolizes slowly and so can lead to overdose or addiction if not monitored. The drug is sometimes used as a replacement opioid for heroin treatment in place of methadone. Only 4% of overdose deaths used opioids have been seen with propoxyphene. Fentanyl was the most powerful of opioids as it is 50 to 100 times stronger than morphine. It is used pre- and post-surgery to alleviate excessive pain. It also now comes in a patch for chronic severe pain and in a lollipop. There is also an oral transmucosal tablet called Actic, meant to be dissolved in the mouth. Street chemists have been able to replicate the structure of fentanyl with a powerful drug called China White. Unfortunately, some of the street drug contains MPTP, which kills the dopamine-producing cells in the brain, resulting in Parkinson's disease at best, and at worst, a frozen addict who can't move for the rest of their lives, and they don't live for very long. Fentanyl overdose death. Prince died of a fentanyl overdose death. Tom Petty had 3 different types of fentanyl in his body when he died. Michelle McNamara, and I can't remember what his name is. She was the wife. She was a journalist, and she was the wife of this guy, who's a comedian. Anyway, she died of a fentanyl overdose. As if fentanyl wasn't killing off enough people, the Food and Drug Administration has approved Disuvia, which is 10 times stronger than fentanyl and 1,000 times stronger than morphine. The drug is so strong that coming in contact with its dust from manufacture can cause an instant overdose and death. Disuvia. LAAM is a long-acting opioid that is used for heroin replacement therapy. LAAM lasts for two to 3 days, whereas methadone lasts for only 1 to 2 days. Because it only has to be taken every third day, take-home doses are unnecessary, as is the case with methadone. LAAM metabolizes in the system too slowly for the drug to be used for pain management. LAAM is more tightly controlled than methadone, and despite its success in treating heroin addicts, the paperwork involved makes it an unattractive alternative than the more widely used methadone. Now I need to tell you that I am one of very few people who is not sensitive to opioids. They don't work on me. I was an athlete as when I was younger. I had my tonsils taken out, and they gave me codeine. It didn't take away the pain. I had my knee operated on, orthoscopic surgery. They gave me hydrocodone after the surgery, and it didn't work. Didn't take the pain away. I had to take Tylenol. Tylenol worked, but the hydrocodone didn't work. What else? Something else. Wait a minute. When they went to knock me out, I had a heart attack, and they needed to do not surgery. It was they did a catheter, heart cath, and they shot me up with fentanyl and a bolus of fentanyl and morphine, and they started cutting on me, and I waved my hand and said, "Hey, wait a minute, guys, I'm not asleep." And they hit me again with a second bolus. Normally, one bolus, of course, knocks out a person. It wasn't because I was too fat. It was because I'm not sensitive to that stuff. I've awakened during surgery twice, which is no fun at all. But the reality is I'm not sensitive to opiates and opioids, which makes me a really bad addict, I guess, since it doesn't do anything to me. I couldn't possibly be addicted to it, and that may be one of the reasons why I don't drink. I don't smoke marijuana, of course. I'm just not. I'm not. I can't be addicted. Can't be addicted to anything. Naloxone and Naltrexone are opioid. About 5% of the world's population is insensitive to opiates, and I just happen to be one of them. Naloxone and Naltrexone are opioid antagonists, blocking all the exogenous and endogenous opioids. These drugs can be given to people who have overdosed on opioids, blocking the deadly effects of the opioid structure. Unfortunately, naloxone is short-acting and has to be frequently administered to block the deadly effects of the opioid chemical. Naltrexone blocks the effects of opioids for up to 72 hours to help prevent relapse. Buprenorphine is a powerful opioid agonist at low doses, but at high doses becomes an opioid antagonist. At low doses, it is used as an analgesic substitute for morphine. It is 50 times stronger than heroin. At high doses, it has an inverse agonistic effect and will block opioids from receptor sites for up to 30 hours. At high doses, it can be used as a part of an opioid treatment regimen because it blocks the effect of the opioids while taking the edge from some of the side effects. Clonidine is often used to diminish nausea, anxiety, and diarrhea from opioid withdrawal symptoms. It also reduces opioid craving. It reduces the overactivity of norepinephrine receptors and can cut the withdrawal time in half. Used in conjunction with naltrexone, clonidine can reduce withdrawal recovery from 1 month to 5 days. Tramadol and butorphanol or Stadol. These new synthetic opioids are developed as less abusable or addictive analgesics. These drugs are still abused and have been classified as a Schedule IV drug. Sedative-Hypnotics are any drug that relaxes and soothes the body and the mind. Sedatives eases anxiety or induces sleep. Hypnotics. The two main categories, benzodiazepines. Two examples are Xanax and Klonopin, alprazolam and clonazepam, and barbiturates. Phenobarbital is an example of barbiturates. Just under half of all prescriptions for psychiatric medications are written for antidepressants. The first sedatives were bromides, also used as anticonvulsants in the 1850s. The biggest problem with these drugs was the fact that they had a long half-life, so toxic levels could build up in the body. Around the American Civil War, chloral hydrate started being used as a sleep aid and a sedative. It was used to treat tension, pain, insomnia caused by alcoholism, pregnancy, neurosis. It was used as the original Mickey Finn to knock out men so that they could be shanghaied. In 1882, it's actually 4 molecules of alcohol, so you can imagine it gets you drunk really fast. In 1882, physicians began using paraldehyde to control alcohol withdrawal symptoms. It is still sometimes used to treat alcohol withdrawal symptoms despite addictive properties and the unpleasant odor. Smells like rotten eggs. Barbiturates were first developed at the end of the 19th century, and their popularity peaked in the 1930s and 1940s. Barbiturates are any compound synthesized from barbituric acid, phenobarbital, saccharbarbital, and phenobarbital, pentobarbital, phenobarbital, and secobarbital. These substances are highly addictive and fairly toxic, making them fairly dangerous. Miltown or meprobamate was used fairly extensively as a sedative in the late 1940s into the 1950s. It became popular with housewives and came to be known as Mother's Little Helper. Less dangerous than barbiturates, it maintained its popularity until the 1960s when benzodiazepines were developed. Dilaudid was also used as a barbiturate substitute. Unfortunately, it was weaker than phenobarbital. It was just as addictive as barbiturates. It is no longer manufactured in the United States. Librium was the first benzodiazepine developed in 1954. Along with diazepam, Valium, these two drugs dominated the sedative hypnotic market until the invention of Prozac. Thought to be a good alternative to the highly addictive barbiturates, benzodiazepines proved to be very addictive themselves, with just as dangerous withdrawals as barbiturates. Today, there are several new drugs that are being advertised as less addictive. Lunesta, Buspar, Rosarim, Ambien, Lyrica, and only Buspar and Rosarim have been proven to be less addictive. So that may be one of the reasons why you don't see Lunesta commercials on television anymore. Sedative hypnotics proved to be so addictive that their use waxed and waned over the years. At this point in time, benzodiazepines are used sparingly, and they have been replaced by psychiatric medications that are less addictive, and there is a lower possibility of adding them to other medications to get a high. Sedative hypnotics can still be abused if the drug is overused when prescribed by the physician. It is used in combination with other psychoactive substances for the synergistic or counteractive effect. The drugs are borrowed or stolen from someone as a form of some medication. The drugs are obtained by other illegal means, for example, forged prescriptions or buying on the black market. The list of celebrities who have died from barbiturate overdoses is long. Marilyn Monroe had high doses of Nimbutal and chloral hydrate in her system when she died. Dorothy Dandridge had a high level of tricyclic antidepressant imipramine, also known as Tofranil, when she was found. Jimi Hendrix was a notorious drug mixer. Hendrix had high levels of secobarbital in his system when he asphyxiated on his own vomit. The drug was prescribed to his girlfriend, and there you go. Bruce Lee, the quintessential martial arts expert, died from an allergic reaction to a painkiller containing aspirin and meprobamate, Miltown. Freddie Prinze shot himself while under the influence of Quaaludes. Prinze was a star of the hit sitcom Chico and the Man. He was Chico. Elvis Presley was a notorious prescription pill mixer. When he died, he had 14 different drugs in his system, including codeine, Quaaludes, and methaqualone. Keith Moon was a drummer for The Who and an alcoholic when he tried to clean up. The drug he was using was the sedative clomethazole. He had 10 times the daily dosage in his system when he died. Abby Hoffman was a 60s anti-war activist. Hoffman was found with 150 tabs of phenobarbital in his stomach. His death was ruled a suicide. Steve Clark was the lead guitarist for Def Leppard. Clark was found by his girlfriend with respiratory failure from the use of painkillers, Valium, antidepressants, and alcohol. Margot Hemingway was an actress and the granddaughter of the iconic author Ernest Hemingway. Granddaughter Hemingway was found dead from an overdose of phenobarbital on the 35th anniversary of her grandfather's suicide. Rob Pilatus, Millie of Milli Vanilli, died of a heart attack induced by a sedative given to him to help with alcohol withdrawals. He was taking the drug with alcohol, of course. Dana Plato, the actress from the sitcom Different Strokes, died from a mixture of Soma, which is a muscle relaxant, and Vicodin. Plato had a long history of prescription drug abuse. Old Dirty Bastard, the lightning rod of the rapper band Wu-Tang Clan, died from mixing tramadol, which is a painkiller, with cocaine. Chris Penn, an actor and brother of Sean Penn, died from a mixture of promethazine, which is an antihistamine, and codeine. The combination mixed with obesity created a fatal enlargement of his heart. R&B singer Gerald Levert died from a combination of Percocet, Vicodin, Darvocet, Xanax, and 2 antihistamines. Anna Nicole Smith, the blousy blonde and Playboy bunny from Texas, who shocked the world by marrying a one-foot-in-the-grave billionaire, died with 11 drugs in her system, including Ativan, Cirax, Klonopin, chloral hydrate, Lexapro, Valium, Noctec, and Zoloft. Posthumous Academy Award winner Heath Ledger died with 6 drugs in his system: Oxycodone, Hydrocodone, Xanax, Valium, doxalamine, and temazepam. Michael Jackson had a number of drugs in his system when he died, but the combination that killed him were propofol, lorazepam, midazolam, and Valium. Officially, Corey Haim died of pneumonia, but the actor had been fighting drug addiction most of his adult life. He was found unresponsive with lethal doses of 4 different substances in his body: Valium, Vicodin, Soma, and haloperidol. Any of each of those would have killed him, but he had 4 lethal doses of 4 different drugs. Amy Winehouse was a notorious drug experimenter who went through rehab several times before her death at 27. She had started several episodes of binge drinking and then abstaining before her death. She died of alcohol poisoning with an ETOH, with an alcohol, that's ethyl alcohol, of 0.416. Whitney Houston had been a notorious drug mixer most of her adult life. She was found drowned in her bathtub with high levels of cocaine, Flexeril, Benadryl, Xanax, and marijuana. Strangely enough, her daughter, Bobby Brown, died exactly the same way. Judy Garland had been a child star and had started a pattern of excessive work days fueled by uppers and downers. At 47, she died of a secobarbital overdose. Philip Seymour Hoffman was a highly touted actor nominated for 4 Academy Awards, of which he won once. He died at 46 from an overdose of heroin, cocaine, amphetamines, and benzodiazepines. Tom Petty was a rocker for 4 decades. He died at 66 with 3 forms of fentanyl in his system, along with oxycodone and 3 types of benzodiazepines. Kurt Cobain was the iconic frontman for the alternative rock band Nirvana. While Cobain died of a shotgun blast, he had excessive amounts of heroin and Valium in his system when he died at 27. Jim Morrison was the lead singer for the San Francisco band The Doors. Morrison considered himself a poet and a philosopher as well as a singer. Morrison died of a heroin overdose in his bathtub at age 27. Janis Joplin was a rock star from the late 60s and early 70s. She partied with such iconic figures as the Grateful Dead and Country Joe and the Fish. She died at 27 of a heroin overdose. Prince was a singer and songwriter from 1980 until his death in 2016. His album Purple Rain is one of the most celebrated albums of the last 50 years. He died of a fentanyl overdose at 57. John Belushi was one of the major original players on Saturday Night Live. He played Joliet Jake Blues of the Blues Brothers. In 1982, Belushi overdosed on a speedball at age 33. River Phoenix was a child actor from the late 80s who was headed for success. A star of Stand By Me, Indiana Jones and the Last Crusade, and Sneakers, he died of a speedball overdose outside a club in Los Angeles at age 23. Chris Farley was a comedian of SNL fame, Saturday Night Live. He starred in such movies as Tommy Boy and Beverly Hills Ninja. He died of a speedball overdose at 33, like his hero, John Belushi. At present, benzodiazepines are the most widely used sedative hypnotics in the United States. Benzodiazepines vary in their half-lives and can cause tissue dependence. For this reason, they can be highly addictive with severe withdrawal symptoms. Most physicians only use benzodiazepines as short-term fixes for specific conditions. In order of usage, the most widely prescribed benzodiazepines are alprazolam, Xanax, 34 million prescription, lorazepam, Ativan, 19 million prescriptions, clondiazepam or Clonopin, 16.7 million dosage prescriptions, diazepam, Valium, 12 million prescriptions, and temazepam, Restoril, 7.6 million prescriptions. Benzodiazepines are used to reduce symptoms of anxiety and panic disorder, reduce anxiety and apprehension in surgical patients, treat sleeping problems, control skeletal muscle spasms, control seizures, dampen acute alcohol withdrawal symptoms. Side effects of benzodiazepine usage is very similar to alcohol. Benzodiazepines are most often abused in conjunction with other drugs, as they are used to lessen the effects of withdrawal symptoms: methamphetamines, cocaine, and heroin. In one study, 100% of the benzodiazepine addicts were addicted to other substances as well. The typical benzodiazepine user is a white, well-educated, 30-plus female. Benzodiazepines work because they increase the effects of the inhibiting neurotransmitter GABA in the cerebellum, the cerebral cortex, and the limbic system. The stronger influence of GABA inhibits anxiety-producing thoughts and overstimulation of neural messages. Benzodiazepines are metabolized by the liver to produce more powerful metabolites. The original drug and the metabolites tend to stay in the body for an extended period of time because they are extremely fat-soluble. Alprazolam, Xanax, is used for generalized anxiety disorder, panic disorder, and depression. Triazolam halcyon is used for short-term treatment of insomnia, 7 to 10 days. Diazepam Valium is used for anxiety, skeletal muscle spasms, control of seizures. IV Valium is used as a sedative before surgery. Tolerance has to do with liver efficiency. Older individuals will have a stronger reaction than younger persons. Overdose of benzodiazepines can cause dementia-like symptoms in the elderly. Tissue dependence can occur with excessive use over several months or normal usage over a year. Because of the drug's lipophilic properties, that means that they're fat-soluble, even small doses over time can cause tissue dependence and addiction. Withdrawal from benzodiazepines can be severe and take several months to taper off from the drug. Symptoms include recurrence of original symptoms, magnification of symptoms, exaggeration of the recurrence of symptoms, true withdrawal caused by low GABA and excess epinephrine and norepinephrine. Onset of withdrawal begins after 1 day, with short-acting benzodiazepines and lasts for 7 to 20 days. For long-acting benzodiazepine withdrawal begins after 5 days and takes up to 28 days for the symptoms to subside. Rohypnol is a benzodiazepine that causes short-term memory loss and sedation. The drug has been used for short-term memory impairment and has been used as a date rape drug since the 1970s. Rohypnol, or roofies, are also known as roofies, has been banned in the United States along with GHB since 1996. GHB is also used as a date rape drug. Buspar is commonly prescribed as an anxiolytic and in combination with an SSRI to treat depression. Buspar does not increase GABA. This drug does not seem to cause addiction and is rarely abused. This drug cannot be used to treat seizures. Lunesta is a hypnotic drug prescribed for insomnia. The drug increases GABA production, leading to relaxation. This substance is only addictive when taken with another drug. Echloravinol or Placidil is actually a chemical ether. Chloral hydrate is actually 3 molecules of ethyl alcohol fused together. Sorry, I said it was 4 molecules. It's only 3. Both these drugs are prescribed to induce sleep and have a long history of addictive use and toxic overdose. GHB is a rapid sleep inducer. GHB increases the body's level of growth hormone, HGH. It affects our sedation, disinhibition, empathy, sensory enhancement, and euphoria. Its effects last 3 to 6 hours. These drugs are metabolized into GHB, GBL, and BD. These two substances have been formulated into mint-flavored rave elixirs, blue nitro, revivrant, gamma G, Rimforce, and Insomex. Methaqualone, also known as Quaaludes, effects are similar to those caused by alcohol and linger for 60 to 90 minutes. The sedating effects last for 6 to 10 hours. This is the drug that is often abused in South Africa, Quaaludes. The drug is used to treat, what are we talking about? Lyrica. This drug is used to treat nerve pain from the shingles or diabetes and can be part of seizure treatment. More recently, it has been used for the treatment of anxiety, sleep, and mood disorders. This substance is rarely abused alone. Rosarim activates melatonin receptors in the brain. Melatonin is a substance that helps maintain the circadian rhythm. Used for short-term treatment only. When taken with alcohol, the result can be toxic. The Z drugs. These 3 drugs are known as the Z hypnotics. These drugs are short-acting drugs with 1 to 4 hour half-lives. Excess use causes nausea, headaches, diarrhea, and drowsiness. These drugs are rarely abused except with other drugs. And that is the end of the chapter. So there you go. Something to know.